Hello everyone, I am Pat Agridente from BS into 12K Group 42. And for today, I'm going to perform a perineal flushing return demonstration. Perineal flushing is a hygienic procedure that involves cleaning the perineum and genitalia. Washing these areas properly is very important to prevent infection, odors, and irritation. Perineal flushing is mostly needed for those who are bedridden, those who are dealing with incontinence, and those who have an indwelling catheter. Okay, so prior to the procedure, I have prepared the necessary equipment needed, which includes the bedpan, the rubber sheet, the kidney basin, the sterile forceps, the 7 pieces dry cotton balls, the 7 pieces of cotton balls soaked in the cleansing solution, an antiseptic spray, pitcher with warm water, and a new set of clean underwear. So now I have to perform hand washing technique. This is to do the spread of the microorganism. Okay, so once we are done, we must introduce ourselves to the client, verify the patient's identity to make sure that we are doing the correct procedure to the right patient, and also we can assess the patient accordingly. Okay? Hello ma'am, good morning. I am Tatan Ridante from Davao Doctors College. So, may I see your wristband ma'am? Okay, please state your complete name and your birth date. Okay, so how would you like me to call you ma'am? Okay, Ma'am Teddy. For today, we will be doing the perineal flushing, where in this procedure, I'll be washing your perineal area, or particularly your genitals, with warm water and cleansing solution to remove perineal secretions and odor, and also to prevent infection and contaminations, which would also promote your comfort. So later, ma'am, I'll be exposing your perineal area and touching some of your parts of your genitals. So would that be alright, ma'am? Okay. So it is really important to provide the client's privacy by locking the patient's room and drawing the curtains. Okay, so ma'am, before we start, ma'am, you do not have to worry since I have already closed the doors and drawn the curtains for privacy, ma'am. And I'd like to ask, ma'am, if you are comfortable with the lighting and temperature of this room. Okay. So next thing that we're going to do is to wear a gloves for infection protocol. Okay, so now we're going to position our patient in a dorsal recumbent or backline position with the knees flexed and spread well apart. This is done to provide good visualization of the area to be cleansed. Okay, ma'am, so I need you to flex your knees and spread well, so I'm going to assist you, ma'am. Okay. Okay. So, ma'am, since you're already draped with a blanket, I'm now going to expose your perineal area. So, are you all comfortable with that, ma'am? So, just tell me, ma'am, if you feel uncomfortable during the procedure. Okay? Okay. So, remember that we are only exposing the area that we will be cleaning to avoid making patients feel embarrassed and to avoid chills. Okay? Then we're going to place a rubber sheet or draw sheet and bedpan under the patient's buttocks. We do this to prevent the bed from becoming soiled. Okay, ma'am? So I'm going to place a draw sheet. Can you please lift your buttocks up? I'm going to assist you. Okay. Okay, so now, ma'am, I'm going to put a bedpan underneath your buttocks. So please raise your buttocks up, ma'am. I'm going to assist you. Okay. So, now we will flush the perineal area with warm water while inspecting the perineum. Okay, ma'am. Now I'm going to flush the water on your perineal area, ma'am. Would that be alright? Okay. So, ma'am, how's the water to you, ma'am? Is it okay? Is it warm? Okay, good. So, we must note any forms of inflammation, swelling, excessive discharge, secretions from the orifice, and also the presence of odors. Also note that we have to use warm water to avoid chills and dissolve any blood clots. Okay, so now we use the cotton ball soaked in the cleansing solution using our pick-up forceps to maintain its sterility. Okay, now we're going to start cleansing the external genitalia starting from the midline of the symphysis pubis down to the anus. Okay, I'm going to discard it right here. Okay. So next is never trace a stroke to prevent contaminating the cleansed area, and after doing this, we'll be discarding the cotton. So now with our second cotton ball, we'll clean the labia majora by starting from the mons pubis, okay, and figure of 7 by way of external labium towards the anus. Okay, and we're going to discard it. Okay, we're going to discard. Secretions that tend to collect around the labia minora facilitate bacterial growth. Okay, now we're going to do the same procedure on the opposite side of our next cotton ball. We're going to discard this used cotton ball. Okay, so next we'll be cleaning starting from the mons pubis, but this time in figure of 7 by way of internal labium towards the anus. And discard. Okay, and we're going to do the same procedure on the opposite side of our next cotton ball. And we're going to discard. Okay, so with another cotton ball, we will be cleansing the groin starting from the groin, going up the thigh area. Okay. And then discard it. And we're going to use another cotton ball for the other side of the near groin area. Okay, and we're going to discard it. Okay. Since we are done cleansing, we will now flush the perineum thoroughly with sterile warm water. Okay, ma'am, I'm going to flush it now with warm water. Okay. Now in drying, I'll be using dry cotton balls to be used in the perineum with the same stroke as when we cleanse using the soaked cotton balls. This step is very necessary since moisture supports the growth of microorganisms. Okay, so now we'll continue on drying the area starting with the midline of the symphysis pubis down to the anus. Discard. Next is to use another cotton ball, now from the mons pubis in figure 7 by way of labia majora towards the anus. And discard. And repeat on the other side using another cotton. Okay, so next is from, and we're going to discard it. Next is from the mons pubis in figure of 7 by way of the labia minora towards the anus. And discard it. And we're going to use another cotton. And the same doing on the other side towards the anus. And I'm going to discard it. So now with another cotton ball, dry the groin area up to the thigh. Okay, discard. And we're going to use another cotton to dry on the other side of the groin up to the thigh. And discard. Okay, so alright ma'am, since you're done with your perineum area, I will now remove the bedpan, so kindly lift your buttocks up for a second. I'm going to assist you. Okay, thank you ma'am. Okay, so kindly, ma'am, can you turn to your side so I can also dry up your buttocks area? I'm going to assist you. Okay. So if necessary, take one cotton ball and clean one side of the buttocks. Then clean the other side of the buttocks and dry both buttocks to provide patients comfort. Okay. I'm going to use cotton ball. I'm going to dry the buttocks of the patient. I'm going to discard it. And I'm going to dry the other side of the buttocks of the patient. And I'm going to discard it. Okay? So, alright now, we are done with the procedure. And you can go back now to your previous position. So I'm going to assist you, ma'am. Okay? So ma'am, do you feel any discomfort? Okay. So now we're going to use an antiseptic spray to promote healing. Ma'am, I'm going to spray now an antiseptic spray. Okay, this is to promote the healing now. Okay. So after that, we're going to put the perineal pad with an up-down motion as needed to prevent contamination of the vagina and urethral area from the anal area. If deemed necessary, let the patient wear an underwear with the perineal pad. Okay. Now we're going to use the underwear. I'm going to put now the perineal pad on the underwear of the patient. Okay. Okay. So now I'm going to let the patient wear this, and I'm going to assist. Ma'am, okay, so I'm going to assist you on wearing your underwear, ma'am. Okay? Okay. So, um, okay, ma'am. So now that we're done with the procedure, I am going to cover you up now. Okay. I'm going to assist you. Okay, ma'am. So how do you feel? All right. Thank you so much, ma'am. So that is it for today, and I will now leave you so that you can continue getting some rest. Okay. Thank you so much, ma'am. Okay. So since we are done with the procedure, we must do an aftercare and the materials used. Okay. Next is we're going to remove our gloves. And we're going to perform another hand hygiene as universal precaution. Okay, so lastly, we need to record the treatment done to the patient and any observable discharges of unusual findings. Okay, so this is important for documentation purposes and means of communication to other healthcare providers. Thank you so much, and that is it for my perineal flushing return demonstration.